So before I enter the room, I'm going to gather my supplies. What I have are my clean gloves, my sterile gloves, my bio patch, my dressing kit, as well as the mask that I'm already wearing. So I'm going to enter the room now. Knock, knock, knock. I'm going to wash my hands for 20 seconds. Good afternoon, Mr. Jones. How are you doing today? Good. My name is John Michael Lozada, and I will be your student nurse today. Could I have you state your name and date of birth for me? Okay, thank you so much. Let me go ahead and scan your armband. Okay, that matches. Okay, Mr. Jones, so today we are going to be changing the dressing on your central line. And we do this as per hospital protocol every 7 days as to prevent any contamination or infection. Now, Mr. Jones, do you have any allergies that I should be aware of, specifically to chlorhexidine, latex, or tape? Okay, are you feeling any pain today? No pain? Do you have any questions or concerns about today's procedure? Okay, so Mr. Jones, if at all during the procedure you feel any discomfort or pain, please don't hesitate to let me know. Okay, so now I have already washed my hands. I'm going to go ahead and don a pair of clean gloves, and I'm going to begin to prepare my work area. And I'm going to start by wiping the tabletop with a sandy cloth for a full 30 seconds. Okay, I'm going to dispose of that, and now that I've wiped the tabletop, I'm going to let it dry for a full 2 minutes. Okay, a full 2 minutes has passed. I'm going to go ahead and place my materials on the tabletop for easy access. I'm going to doff my gloves, and I'm going to perform hand hygiene for another 20 seconds. And now what I'm going to do, I'm going to position the patient not only in a comfortable position, but in a position that is easy for me to access the central line. And I'm also going to ask the patient, that the patient wear a mask, and have him turn his head to the side as to prevent any contamination from entering the central line. Okay, so now that I've done that, I'm going to perform hand hygiene once again for 20 seconds, and I'm going to get my dressing kit and open it, making sure only to touch the edges and nothing inside. I'm going to go ahead and tuck in like so, and I'm going to drop in the bio patch. Okay. Okay, so now that I've done that, I'm going to perform hand hygiene once again. I'm going to don a pair of clean gloves. And what I'm going to do now, I'm going to assess the length of the central line, compare it to what was previously charted. On the chart it says 5 inches, and I see that here is also 5 inches. And the reason we do that, we want to make sure that the central line didn't move, that the sutures are in place, and nothing out of the ordinary has happened. Okay, so now that I've confirmed that, I'm going to begin to remove the old dressing. Mr. Jones, like I said before, if you feel any pain during this removal, please don't hesitate to let me know. Are you doing okay, Mr. Jones? Good. Okay, so while I'm doing this, I'm making sure to secure the central line in place, as well as keep my hands away from the insertion point itself. Okay, so now that I've removed that, I'm going to dispose of the old dressing. And what I'm going to do now, I'm going to assess the site for any redness, any swelling, any infection. Nope, okay. And I'm going to also inspect the tubing for any cracks or leakage, and I see everything is okay. So now that I've done that, I'm going to doff my gloves. I'm going to perform hand hygiene once again. And now I'm going to take out my sterile gloves, making sure only to touch sterile gloves when entering the sterile field. I'm gonna move the sterile field away. And once I have my sterile gloves on, I'm gonna make sure not to put my hands below my waist. I'm also going to make sure only to touch the outer edges and nothing on the inside of the wrapper. Okay, so now that I've donned my sterile gloves, I'm going to dispose of the wrapper, again making sure not to put my hand below my waist. I'm going to move the sterile field towards me, like so. I'm going to secure the central line with my non-dominant hand. I'm going to grab the chlorhexidine with my dominant hand, and I'm going to crack it. And now I'm going to clean the site of the incision site, a 2-inch border on all 4 corners for a full 30 seconds. Okay, now that I've done that, I'm also going to clean from the bottom of the tube all the way up to the top. Okay, now that I've cleaned that, I'm going to dispose of the chlorhexidine. I'm going to grab the bio patch. Again, making sure only to touch the top of the bio patch. And placing like so. Now that I've done that, I'm going to remove my tegaderm. going to stabilize the central line with my non-dominant hand. Going to remove the wrapper. I'm going to place it like so. Okay, so at this point in time, I'm going to make sure the tube is secure by applying a tape at the top of the tubing. And I'm going to initial and date. The dressing itself. And today is this September 16th, and my initials are JM. Okay, now that I have done that, I'm going to dispose of the old materials. Okay, and Mr. Jones, just to let you know, the reason why we have this cap and this clamp, it's to prevent any contamination. And again, I wouldn't say this to the patient, but we also have the cap and clamp to prevent any air from entering, as to prevent air embolism. Okay, so now that I have done that, I'm assessing the site. Everything looks intact. Again, there's no redness, no swelling. Everything seems to be okay. At this point in time, I'm going to ask the patient if he's doing okay. Are you feeling any pain, Mr. Jones? And how was that procedure for you? Okay. And do you have any questions or concerns about the procedure? Okay, so I'm going to doff my sterile gloves. I'm going to perform hand hygiene for 20 seconds. Okay, and upon leaving the room, I'm going to make sure that I document the date and time, which is the 16th of September, as well as my site assessment. No swelling, no redness, no infection, as well as the patient's tolerance of the procedure, which was pretty well, no pain at all. And yeah, before I leave, I'm going to make sure the call bell's right next to you. I'm going to make sure the side rails are, both side rails are up, and I'm going to make sure the bed is in its lowest position. If you need anything, Mr. Jones, please don't hesitate to let me know. Once again, I'm going to wash my hands. I'm going to exit the room. Thank you.